and thank you for joining today's class presentation, EDIS 2013, Revealing the Physician's Voice. I'm Graham Triggs, and I'll be hosting the presentation with Eric Bermudez from class and Dr. Michael Girardi from ASAP. We encourage questions, so if you'd like to participate, please use the raise your hand or chat features, and we'll address the questions as time permits during or following today's presentation. Just to make you aware of a few upcoming reports that class will be presenting, we have those listed on the screen for you. And also, we wanted to make you aware of our next webinar, which will be held on April 24th at 1 p.m. EST. That will be EMR Usability Beyond Counting Clicks. So please join us for that. Let's jump into today's presentation. Eric, you're the report author of the 2013 report. Now, over the years, class has done several reports on the ED area. Tell me a little bit about some of those reports and what we've typically done in this area in the past.
Yeah, Graham, thank you for the introduction. Excited to be here with everybody. Class has measured the EDIS segment for years. As you can see, since 2003, we've done many reports over the years, and we've really talked to a lot of folks at the hospitals to get a good perspective on how these ED systems perform. And, so whether that means we get the CIO on the phone, the ED director on the phone, an ED physician on the phone, or an ED nurse, we really, over the past 10 years in these reports, really got some perspective from everybody. And the difference in this year's report, what makes the 2013 report unique, is that we only talk to the ED physician. And that really sheds a different light and different perspective on the performance, as you can imagine.
So I'm guessing that there's probably some changes from what we've typically done in the past to what we're hearing from physicians then?
Absolutely. It's very different. In fact, as you can imagine, only looking at the ED physician's voice and eliminating the IT perspective's voice and the administration's voice, you're going to get some different results, as you would expect.
Well, tell me a little bit about what we've traditionally seen from the IT perspective.
Yeah, the IT perspective has a unique focus on the performance of a system. Namely, they're making sure that a system is up and running, that a system is reliable, that the data can be transferred between disparate systems. They have a much different focus and a much different feel on a system's performance than actually if you go out and talk to an ED physician. And that's one of the reasons why Dr. Michael Girardi is on the phone with us today. We had the unique experience about a year ago with Dr. Girardi that where actually this report idea of only talking to physicians was born. Dr. Girardi, do you mind sharing your thoughts on the purpose of this report and how is it helpful to the industry today?
Yeah, thank you, Eric and Graham. Well, there I was sitting at the Emergency Medicine Patient Safety Foundation second annual summit with many ASAP members there, American College of Emergency Physicians. And Eric was doing a presentation, and I was struck by the fact that what he was presenting didn't reflect the reality of our physicians working at the bedside and in emergency departments. Let me just preface my remarks by saying emergency physicians are the largest adopters of the EHR, the electronic health record, or EMR, of any other specialty. So we do have quite a bit of experience as a body of physicians using these systems. We all agree that we are moving to an EMR, and there's going to be great advantages to healthcare improvement and reform as we move to measure quality and outcomes and value. And so we want to embrace these systems. But we're still a little frustrated because we're finding at the bedside and in the emergency department that many of the best-of-breed systems are being surpassed and overlooked by larger enterprise systems that are tackling different issues than those of the physician at the bedside. So our physicians, as you'll see going through this presentation with Eric, many of our concerns seem to be not listened to or weren't a priority. And so listening to Eric, I represented, I think, the emergency physicians in the room, and another colleague of mine, Drew Fuller, were saying, geez, if class does these type of surveys and investigations, why don't they come to the people who really use the systems in the departments? Because it became apparent that the chief information officers, the IT people, chairmen of the department who may or may not work as much clinically, may not be presenting the real-life experience of our physicians, residents, nurses, etc. And so Eric was very receptive to listening to the American College of Emergency Physicians' concerns and thinking, well, let's see if we can develop a project together and see if there is a difference and a whole new perspective. And that's what you're going to see some of today.
Well, we really appreciate your input, Dr. Girardi, and we really appreciate you being on the phone with us today to kind of give you your perspective on this whole issue. Can you tell us a little bit about why you feel like there may be that disconnect of why some feel one way about a particular ED system and others feel a little bit differently, and why the reality in the ED might be a little bit different than the class scores that we've typically gotten in the past, Eric and Dr. Girardi?
Well, yes, I think that emergency departments are very busy. Volumes are increasing continuously. Our doctors already feel pretty stressed many hours of the day. And our hands, as I pointed out last year, are made for touching patients and caring for patients. We're really not meant to be a keyboard, even though our 10 digits work very well that way. I just wanted to impart upon the fact of class that our physicians are seeing incredible drops in productivity when using certain systems. They find there's certain glitches that could be cumbersome. But that's not to say there's not any good things that are coming out. There are many good things. But I think that when these systems are installed, I don't think people quite realize the profound impact they have on the flow of an emergency department, how they have an impact on safety, and the overall patient care process. So that's why I was interested in seeing how we could create questions to really reflect what I'm hearing from our members in the college about these different systems. So, by the way, and throughout this session, I will point out many of the good things that EMR has been bringing to our practice.
No, that's fantastic. Thanks, Dr. Girardi. And the reality is, in today's market, the enterprise systems are coming in and, like we've already stated multiple times, replacing best-of-breed systems, especially as we look at the larger hospitals and what's going on in the industry today. And that's why, you know, some may have a smile on their face and are happy with that movement because of, you know, overall ease of use, managing multiple systems and consolidating. And I imagine maybe there is a portion of physicians that are happy with that move. And then there's that other group of either physicians or IT folks that are looking at themselves and thinking, okay, I've been using this system for some time, and like Dr. Girardi was mentioning, it's not getting any easier, and it's difficult to work through. My productivity as an ED physician has gone down, and I don't want to be looked at as a data entry clerk. I went to schooling so I can take care of patients. So and I think there's existed in many areas of healthcare today, these two camps that are constantly at tug of war with each other. Do we want to go with that enterprise system and take that one name that covers all of our healthcare technology needs, or do we continue with the niche product or a best-of-breed vendor that really can suit the needs of the ED physicians and end users?
One thing that I really find interesting about this report, Eric, is class typically likes to rank the vendors based on our overall consensus and scoring. But this report really kind of separates the ED physician from the IT user. It kind of dives into it a little bit differently in that way. Why don't you explain to us a little bit about what's going on in the market, and how we can kind of interpret the data that we've collected?
Yeah, as we look at the data, again, this is only looking at the physician scores and the physician perspective. So you can still see that the vendors are ranked and the vendors are still scored in an overall performance score. But we really separated out the physicians' voices versus the IT's and administration's voice. And you can see that there are some big differences. For example, as you look at physician-only scoring, WellSoft scores #1, and among the other best-of-breeds. You can also see that the IT score is not much different. IT is also relatively happy with those best-of-breed systems. As you look at the camp of enterprise, you can see that that's where you really start to see some big gaps in performance from those the physicians and the IT. The one product that stands out is Epic has an extremely happy camp of IT folks where they like how Epic works from a technical perspective, not so much as on the ED side, physician side, as well as most of the other best of breeds, and Meditech and Allscripts and Cerner make up the other enterprise. This was the very first time, I mean, here at Class, and I think in the industry, it's always been known that if you were to go talk to an ED physician, most of the time, they're going to say that a best of breed performs better than an enterprise. It just makes sense. Enterprise vendors have a lot to focus on. They have a lot of products that they're trying to keep up from a regulatory standpoint as well as meeting the end user's needs, and maybe they're not able to dedicate as much time to the development for the ED physician. This was the very first time that instead of it being a general feel or a concept in the industry, we were actually able to put a percentage on that gap. And physicians using best-of-breed systems rated their systems and their experience 59% higher in overall performance score over enterprise. And that was something that was a real astounding statistic to come out with for this report.
Why don't we talk a little bit about...
Chuck, I'd like to interject something here. Yeah, as an end user of a couple of these systems, I have to tell you, even those that rank lower, if you put a best-of-breed physician documentation tool and merge it into the enterprise system, you'll see a ranking change dramatically. For instance, some of those lower-ranked ones, I have actually used them and used a best-of-breed physician documentation system that crosses over into their system, and physicians are much more satisfied. It would change the ranking, I think, from a physician perspective. I just want to let you know it's not just enterprise or best of breed. There are some interesting mergers or crossovers being developed so that the best of breed systems can get into the documentation portion of these enterprise systems.
And that's a great point, Doctor, that we hadn't brought up yet. Even with the advent of scribes, and there are overlay software strictly just for physician documentation, or even, like you mentioned, a best-of-breed coming in and essentially using, having the tools be what the physician uses, and that's actually pretty prominent and coming up and surfacing as a trend in today's industry.
Speaking of that trend, real quick, Eric, you mentioned scribes. It's a growing phenomenon in our specialty, but I have to tell you that as we go forward, we have to address the issue of limited access of scribes to these enterprise systems. The enterprise systems I don't know if it's mandates from other large organizations, such as the Joint Commission, recommending limiting access, but that is another major decrease in productivity by limiting access to non-licensed personnel, and that's going to have to be an open item that needs to be addressed nationally.
Let's take a look at some of the specific vendors. Obviously, we're comparing best of breed to some of the specialty products in the market. Tell us a little bit about what some of the findings were and what some of the surprises were to you as we collected some of the data.
Yeah, I think the first thing, and we've already talked on this for a couple of minutes, but the very first thing that I want to touch on is the difference in scoring between IT and administration and ED physician. And this is a better way to look at it here. You can see that best of breed, there's not that much of a gap. The average gap between those two camps and their scoring is 1.35. And as you look at the other camp of vendors, the enterprise vendors, the average gap is 22.4. And one may think, well, what is causing that, and why is that? And we're going to get into that a little bit further down the road. But that's one of the biggest things, is to take a look at those gaps and really ask, as this industry is moving towards an integrated enterprise system, really what are the effects that that's having on the ED physician's experience with patients and with technology?
I think when anybody's looking at any specific kind of system, obviously you have to weigh the pros of the overall functionality and the best-of-breed abilities of that system, as well as its overall ability to work with the other moving pieces of that product. Tell us a little bit about what you learned about integration versus functionality with some of these products.
Great question. You know, that's one of the biggest issues in today's industry. In fact, I've heard it multiple times that it's no longer the chief information officer, it's the chief integration officer, and that's why we're experiencing the wave of integrated systems that we are, is that people are really seeking that ability to exchange data seamlessly and painlessly across the enterprise. And to really pinpoint what that means to the ED physician, we asked the simple question of, is your system's interoperability meeting your needs in terms of delivering patient care in the ED? Now, granted, there's a lot of variables to that question, and some ED physicians may not know what they don't know, right? If they've never had it, they don't know what they're missing. But at the end of the day, when we took everybody's responses, 62.4% said yes. And even looking at a lot of the best of breeds, majority of the physicians that we asked using their system said, yes, my system is meeting my interoperability needs. So to get the medication list and maybe the med history and the patient's previous encounters in the inpatient, those types of things being delivered to the ED physician, it was meeting their needs. And that was a real interesting finding for us.
Looks like Epic kind of stands out here a little bit in terms of the integration functionality combo.
And that wasn't one that caught us off guard, but that's definitely one to point out, is that Epic was the one that scored the highest in this area in terms of physicians saying, absolutely, yes, it does meet my needs. Now, the interesting point here is it's a different story when you're talking about other physicians, whether they be hospitalists or whether they be the primary care physician of the patient, getting what the ED physician documented and put in the notes and that documentation for the encounter, getting that back out to other areas is a different question. And that's where Epic and Cerner and some of the integrated vendors really came out. And that was another part of the story that we saw in this report, is that as you talk about care coordination and the continuum of care, I think that's why they're built, enterprise systems, is to really foster that ability to, regardless if it's a primary care doc or an internal medicine in the hospital doc, or if it's the ED physician, having that patient record go back and forth is important.
Talk a little bit about the accuracy and the physician's ability to provide a consistent.
Yeah. This was, and maybe you can shed some light on this, Dr. Girardi, but really, as you look at the documentation and as you look at the patient's chart, this is really where an EDIS can make the grade or can break the grade. From an ED physician's perspective, they want something that's easy to use, that's able to produce a legible note at the end of the encounter, that doesn't take more time than needed, and really everyone states the quickest way to document an encounter in the ED is on paper. So being able to match that, but also having the benefits of going electronic is really where the gold pot is for these vendors.
I agree, Eric and Graham, and I saw the arrows you put up there. I think the more drop-downs you have and the more square pegs you try to put in round holes from a documentation perspective creates a very disjointed and uninterpretable chart. And that's where the best of breed has really helped. But I find that a couple things are going on. Between integrating best of breed physician documentation pieces or using voice recognition technology for more free texting or free speaking that's recognized into a printed note, I think you're going to get more accuracy. This is a big issue from a safety perspective. Remember, the medical record helps you transfer information, as you just mentioned, and that's of huge importance. But I also, from a medical legal perspective, I think our physicians are very nervous about some of the things that they're finding themselves signing or reviewing later on from quality initiatives or even peer review saying, who put that in there? How did that get there? So we're all learning, and I think that hopefully physician documentation will get only more accurate and more streamlined as we move forward. And then once again, the scribes seem to be a big benefit in that regard.
What did providers tell us during this study that really helped them in terms of documentation?
Yeah, I think the biggest thing is just the overall ease of use. Having something that is easy to work through, that doesn't take more than 3 or 4 clicks really to get to the data that the ED physician needs is extremely important. And that may sound oversimplified, but really just the ease of use was the one thing mentioned by ED doctors in this study that helped them with their documentation. the other things that were mentioned were helpful templates. Having customized templates that meet the physician's needs, so they're not having to craft something as they go or work through something that doesn't make sense and is not structured correctly as they go, really helps. And then thirdly, having the ease of access to patient information was something that was mentioned. But by all means, just the overall ease of use of an ED system was the biggest thing that helped with documentation.
And conversely, the gotchas?
Yeah, and again, it may seem like an easy answer, but the biggest thing that came up when we asked that question of what hurts documentation, going through the documentation of an EDIS, is it's cumbersome. And that one word, if we were to search for that one word in the report, cumbersome and clunky come up a ton. And I think if from a vendor's perspective, those are two words that you want to avoid when you're talking about your end user's experience. Too many clicks, being too structured, easy to make errors. Those are all things that are not going to help as the ED physician goes through and completes his chart and note.
What can you tell us about that, Dr. Girardi, from your perspective?
Well, I like this slide a lot because it does simply reflect really the overall experience. Let me go to the top. What helps? You find the people who are most happy with the EDIS systems are those that have modified the templates to their own practice and standard practice. You see the biggest smiles on their faces. Let me show you my template. You know, they're very proud of them because it's the way they think and it's efficient. On the bottom, and what doesn't work, the cumbersome nature, the constant have to log in and again because of passwords, too many clicks. Let me just tell you, if you had, let's say, 60 clicks per patient encounter, if you saw 40 to 50 patients on a shift, that adds up to hours of clicking at the end of a shift to complete your notes. And that decreases productivity, increases frustration and fatigue, and possible error rates. That's why the efficiency in being streamlined is so important.
Now let's talk a little bit about the effect that some of these systems have on patient throughput.
Yeah, just like Dr. Girardi was saying, as an ED physician uses in EDIS, there are going to be some consequences, either for the good or for the bad. And one of the things that we've talked about a lot is that one consequence of productivity. As you look at the best of breeds, and we ask that question of, what's the effect of this EDIS on your patient throughput, or in other terms, are you able to see more or less patients? Has it helped or has it hurt your patient throughput? Typically, as we ask the best of breeds, you can see has helped, at least a little bit. For some, less, and for some, more. As you compare that to the camp of enterprise vendors, this is really where the clunkiness of a system and the cumbersomeness of a system can really affect how many patients an ED physician can see and drastically affect their productivity.
And tell us a little bit. Sorry, go ahead, Dr. Girardi.
I think this slide is telling, and that's the real-life experience of our physicians and nurses. And we haven't talked much about nurses yet, but they have a lot of documentation requirements as well. If you look to the left there of the slide, the things that work well for physicians are order sets, for instance, where instead of writing 10 or 15 orders, you have your order set that's been reviewed, and you think, this is how I want to approach an abdominal pain, possible appendicitis, let's say, as an example. You can, one click, you can have your order set to what you want done for that. And that would save time. But as you look to the right there, those are where you have to have multiple clicks and access points to get things done that can really clog up the work, so to speak. And this is at a time, by the way, an expanding electronic medical record age, where waiting times are being posted on the web, et cetera. So our physicians are getting particularly sensitized and sensitive about the amount of time it takes to document.
Great. Now, obviously, during the study, we were able to measure a few things. Tell us a little bit about, Eric, what we learned about the quality of patient care ratings during the process.
This is one area that's incredibly important, I think, for everybody. And when we talk about the quality of patient care ratings, we really focused in on 3 specific areas. And of course, there's going to be a lot of other areas that we maybe missed or didn't capture. But as we went out to the market and really tried to understand what the 3 most important areas are when it comes to patient care ratings, these are the ones that continue to surface. The first one being clinical decision support. So those tools and those algorithms that are constantly looking over either real-time or not real-time patient data and are really probing the ED physician or clinicians for that matter to take action, to take an intervention in the patient's health, whether that's simply asking for an extra field to be filled out, or that's if something a little more catastrophic and a physician has to come in to save a life, and everything in between. That's CDS, and that is becoming a big component in today's healthcare, are those evidence-based alerts and protocols that are built into the electronic medical record to help with patient care and patient safety. The second area is simply avoiding errors. Does this system help you avoid errors as an ED physician? Surprisingly, I mean, one would think, well, doesn't every EMR help avoid errors? And the answer is no. There are some systems that we measured in this report where ED physicians have extreme concerns for this system because it actually foments errors and supports errors versus avoiding errors. And that was one thing that was a red flag to us, and that was interesting, and we'll dig into that a little bit later as we see the actual ratings. And the third is, does the use of an electronic medical record and ED system help facilitate communication among ED caregivers? So whether that's a physical therapist coming in or an ED physician to the ED nurse, or it's an ED director trying to manage from a high level the dashboard and the patient throughput and patient volumes, does this ED system help facilitate communication? And that's really where we wanted to get at as we ask those questions of ED physicians.
And how did the providers stack up in terms of how they were rated in those areas?
Yeah, as you can see, there are some big differences as you look at the vendors and as you look at the performance scores. And again, this is where you can see where the vendors start to separate themselves out a little bit. You know, you have Pisces, T-System, WellSoft, and MedHost, the best of breeds, where they can focus all of their effort in making sure, to the best of their ability, their systems are performing well in those three areas previously mentioned. And then you look at the other four, Cerner, Epic, Allscripts, and Meditech, and that's where you can see where a couple of concerns start to creep up. Is it because of alert fatigue, where the ED physician simply ignores the alerts that are being presented to him on the computer screen? So whether they're valid alerts or whether it was a misfire, either way, alert fatigue is becoming an extreme concern in the industry.
Well, great, Eric. Dr. Girardi, thank you so much for presenting this information from the report, and obviously this is just kind of scratching the surface in terms of all the information that's available on there. Looks like we've had several questions come in during the course of the interview. Eric, I'm going to allow you to field those questions, and Dr. Girardi, feel free to jump in and add any input that you'd like to as well.
Yeah, Graham, just before we go to that one quick point on the last slide, quality of patient care ratings, we have to be careful with these systems that doctors and nurses continue to talk to each other. We find that when these systems are being implemented in our emergency departments, they go into screens and they're flashing warnings or alerts, and people forget to talk to each other at times, and we're losing a little bit of that, and that's a big safety issue for me and some of my colleagues. So I just wanted to point that out.
Thank you for attending today's webinar. We hope that this presentation was insightful and useful. If you could take a few minutes when the webinar closes to share your feedback with us about the presentation, we'd appreciate it, as we're always trying to improve. Also, please let us know if there's any topics you'd like class to present on. If you'd like a copy of the report featured in this presentation or other information that class offers, you can contact your class representative or visit us on our website at www.classresearch.com. You can also follow us on LinkedIn, Facebook, and Twitter. We'd like to thank you again for your participation, and that concludes the presentation today. Have a great day.